help if I unmute. Good morning. We're very glad to have you with us this morning. This is the Hearing Aid Coverage for Children program webinar for families and community partners. And I have here with me today a captioner, and we also have ASL interpretation available throughout today's event. Very glad to have both of you with us as well. Sorry, I'm having a mixed call here. Oh, yeah, hold on, Blair. Sorry about that. That was some technical assistance coming in to help save the day. So this morning, we're in the Hearing Aid Coverage for Children program webinar for families and community partners. If you are new to HACCP, or if you've joined us before and are coming back for a refresher, we welcome you. We appreciate having you here with us this morning for what will hopefully be a helpful and interesting part of your day. We do these events on a quarterly basis, so if you miss any part, we'll go ahead and have a recording available. You can feel free to access that on our webpage. So let me go ahead and get you to that slide as well. So all of our past recorded events are available through our HACCP events archive. We do, as I was starting to mention, have American Sign Language available today. If you'd like, you can go ahead and pin that to your screen top if that will assist with participating today. We do also have live captions available in English and Spanish at the link on your screen, which I will also paste into chat just to make it easier. Just a moment here. That link is also available through the dhcs.ca.gov/HACCP website, right on that main page with the announcements. Give me just a moment. I'll get this into chat for you so you can see it there as well, in case that's easier for anybody. So just not giving me that option. So it looks like the best bet here is going to be clicking that link on the HACCP webpage that I just mentioned. See if we can add to Q&A. So we do also have captions throughout. That's available in English or Spanish. You can change the drop-down box at the beginning of your screen. Sorry for the technical difficulties getting started, but we should be good to go now. So HACCP has been around, and it's overseen by the Department of Healthcare Services. This program was launched in July 2021. So we're still a toddler among other programs that are more established like Medi-Cal, but learning a lot. So we've actually gone ahead and based this program on fee-for-service Medi-Cal. So if you happen to be a provider here with us today, that might be some language that connects with you. It's a lot based on the California Children's Services and more specialty pediatric audiology policies as well. And we do make every effort to make sure that program support is available in all Medi-Cal threshold languages. So if you go to our webpage, much of what you'll see is also available, in English, Spanish, and another 17 languages that are all available. If you have trouble finding anything, we'll also go ahead and provide all of the information on how to contact our help center at the end of this presentation, and the slides will also be available on the webpage that I mentioned. So first off, looking at who's available who's eligible for HACCP. This coverage is available for children 0 to 20 years of age who live in California and are not already eligible for Medi-Cal. So for children, that varies a little bit depending on which county you live in. So if you're in San Mateo, San Francisco, or Santa Clara County, Medi-Cal actually covers up to a higher income threshold than it does for the rest of the state, just because of cost of living and the way that federal assistance is covered. So if you're in those counties, you'll want to cross-reference, and we'll go through this on the next page. So we've got a little chart. You'll want to look at the 322% column for the federal poverty level. If you're in a different California county, you'll want to look at the 266% or general Medi-Cal threshold. And what you're looking at is whether your household income is above that Medi-Cal cutoff, but under the HACCP ceiling. So if you are within the Medi-Cal eligible income range, you're actually eligible for quite a lot more benefits outside of strictly the hearing aid portion. And we can help you find your county office to get in touch with them about enrolling for that broader coverage. On a related note, you want to not already be enrolled in CCS for a hearing related condition if you're applying to HACCP, because HACCP is just going to be redundant of that, but we don't have as much access to those wonderful wraparound services that CCS does to help coordinate with other therapies. If you think your child might be eligible for CCS, we do have links included in the slide deck today. If you have questions about whether you might have diagnostic eligibility for CCS, because there's both a financial component and a diagnostic criteria for ongoing CCS eligibility, we've included those links as well. And would also note that the other piece of documentation required for HACCP eligibility is a provider referral of some sort. So that can be from a hearing professional, it can be from a medical professional, whether that's your child's pediatrician, or if it's an audiologist or otolaryngologist or ENT that they might already be seeing. We do have a form that's available to make it easier for the provider signing. But if they want to just write a short note letting us know, this child's, is being referred for hearing aids or hearing aid related services, we can go ahead and use that as well. So here's the income eligibility chart that we were talking about. So HACCP income eligibility goes up to a household income. So it's qualifying members of your household, like a parent or step-parent, or the child themselves if they're old enough to be working. And then the number of eligible household members. So our team is available to help you with that if you have any questions. That families and households are all different shapes and sizes, and we want to make this as easy as possible. So for folks living in the majority of California counties, if we're talking about a family of 4, that's going to be your family income. It falls somewhere between $80,000 and $180,000. So all the way from, I'll show you right here, it would be between the 79,800 annual income, and this is looking at adjusted gross income, and then all the way up to $180,000 a year. So that's a lot of families that end up being eligible. I will say that one of our top reasons that folks might apply and find out they're not eligible for HACCP is because they got referred for broader Medi-Cal eligibility instead, which is actually a really good thing for your child's coverage because it can help you get all of your coverage in one place. Medi-Cal is able to cover a lot more types of service than HACCP is. So if you find out, especially for folks who might be in one of the C-CHIP counties that we mentioned, they may not realize that they actually have more inclusive income eligibility. So that's definitely good news if you end up being eligible for Medi-Cal as a result of your HACCP application. Definitely feel free to reach out to us if you're curious, or submit an application if you'd like. And if it ends up that Medi-Cal is the better eligibility fit, we're happy to work with you on getting those documents over to the appropriate county office to help you with that warm transition. So the final piece of HACCP eligibility is really getting into the meat and potatoes of what this program is designed for, right? We're looking to bridge that gap that is often existing with private health insurance where, you know, the private plan may exclude hearing aids altogether, or they may have some pretty significant limitations on how much they will cover each year or potentially every 3 years, depending on how the plan is set up towards hearing aids. So if you either don't have insurance, okay, or if you have insurance that leaves out hearing aids and related services, or it limits hearing aid coverage to $1,500 or less per year, that's where you want to go ahead and use HACCP to kind of bridge that gap, and it can be a supplemental coverage just for the hearing aids and related services. There are a few different ways that you can kind of document that with your application. If you don't have health insurance, that's the easiest one because it's just checking a box and then signing your application at the end like you were going to do anyway. If you do have health insurance, but it either excludes or limits your hearing aid coverage, you can either send us excuse me, you can either send us a denial of coverage notice from your child's health insurance plan if you've received one, or you can send us an explanation of coverage. But tends to be easiest for most folks rather than going through the whole denial process if they haven't already had to encounter it anyway, is just to pull that explanation of coverage document that your plan sends you each year. And so for a lot of folks who are just going through open enrollment for this year, you may have already gotten it or you may be getting it in the mail soon. It's just that comprehensive kind of plan brochure that says, you know, for this type of benefit, this is what we cover, this is what your copay is or co-insurance is, and it just works its way through. So usually there's a page that includes hearing aids as a category. If the document doesn't already have your child's name on it, we ask that you include a quick copy of the health insurance card that lists your child as a member, just so we know we're looking at the right plan for the right year and the right child. If you're applying now and what you have available is still your 2023 documents, that's fine. However, if you already have your 2024 documents, go ahead and send those and we can help streamline things into the coming year since we're at the end of the year. The application and enrollment process has certainly come a long way. We're available. You can apply completely online now if you'd like. We do still have paper applications or a downloadable that you can type in and then print and sign if you'd like. Those are certainly available, but the online application portal is going to be the easiest way and is available in all 19 threshold languages. So there's a drop-down box at the top of the screen, and you can select which language you prefer to complete the application in. It also lets you then attach the income documentation or any documentation about your existing health coverage, as well as your hearing aid prescription or provider referral, just as electronic attachments, which if you happen to have, say, your existing medical provider's portal is how you tend to get your child's documents and just download them. It's a lot easier. You can even do it from your phone. So you can just go ahead and keep all of those things electronic rather than having to try to find a printer and waiting for the mail. So once we do get your application and it has all of the pieces, so you want to make sure you've got the form complete, the three different attachments, if they're relevant to you, and then that kind of constitutes the complete application. Once we get it and it's complete, we let you know within 10 days. Yes, you've been enrolled, or hey, we have this question, or it looks like you're not eligible at this time, but please feel free to resubmit. And that might be, for example, if the address you used was outside of California, right? That's an easy one. Or, that would include notifications of, hey, good news, it actually looks like you're eligible for broader Medi-Cal coverage. Let us help you get set up there. And we'll work with you through all of that. So once you're enrolled, or if you're waiting for your enrollment notice, you can actually go ahead and take a look. We've got an HACCP specific provider locator on our webpage. It's at providerca.maximus.com, but you can also access it from the DHCS HACCP webpage that we talked about. If you go under Find a Provider, it gives you some guidance there. If your child is already established with a pediatric provider for hearing aids, you can go ahead and check with them whether they already work with Medi-Cal and CCS, because we're the same system, right? So you just need a provider who's enrolled in fee-for-service Medi-Cal. So that way they can go ahead and get reimbursed for the services they provide. If you have a provider that you really like working with, you want to keep your child's provider consistent, great, we totally get it. You can just share this little link with them and they can go ahead and enroll in Medi-Cal as a provider as well, and they'll be able to bill us through that system. If you do not have a provider yet, like I mentioned, we've got the provider locator. It has a lot more details about providers than some of the other places that you might be able to look for other Medi-Cal enrolled providers. So you can, for example, look through which ages a particular provider serves. It may have more information or more updated information than some of the other online directories that you might be able to find for, say, audiologists, in that you can make sure you've got their current phone number for setting up an appointment. If you're looking for an email address instead to be able to reach out, they may have additional information set up in the notes about what type of services they provide. And we're actually looking for different ways right now to make the provider locator even more helpful. So if you do come across any thoughts or suggestions, oh, I wish I could filter for this, please feel free to let us know. Like I said, we'll go ahead and share that contact information as well. When you go to your child's first appointment to get their HACCP covered hearing aids, you're going to want to bring your HACCP ID card along with any other health insurance card. But you'll also want to bring documents from earlier appointments that you may have gone to. So if you already have a hearing aid prescription from your child's otolaryngologist or ENT, some facilities might call them a head and neck surgeon, you're going to want to bring that document, so the hearing aid prescription, but also any exam notes from that appointment, right? So these are documents that your audiologist with HACCP is going to need in order to get approval for that we're covering the right hearing aids for your child. So the hearing aid prescription, your child's medical history and examination notes from their visit with the otolaryngologist, which is usually the same otolaryngologist who signed the hearing aid prescription, right? And then if you've already gone to an audiologist as well, you can go ahead and bring their hearing aid recommendation and audiologic reports. And that gives your audiologist a good place to start so they know what you've already gone through in the process. But it also lets them have that documentation that they're going to need to get the approvals for DHCF to confirm, yes, this is a covered hearing aid, yes, medical necessity. And we'll go through that process in a minute. But it essentially streamlines your child's access to coverage for hearing aids and getting those dispensed faster. Depending on your child's specific needs and how you're booking the appointment, whether it's for a specific additional request, your child's enrolled provider may, of course, provide or request you bring in additional documents or background information with you. But these are the main guys that we want to encourage you to bring, just to save yourself and the provider some time and get your child those hearing aids faster. HACCP covers a pretty broad range of benefits as long as they're related to hearing aids. So we cover hearing aids themselves, which would include assistive listening devices or ALDs, as well as surface-worn bone conduction hearing devices, which some folks also know as bone-anchored hearing aids or BAHAs. We call them BCHDs throughout this presentation, but the same thing. We cover hearing aid supplies like ear molds and batteries, as well as any medically necessary accessories. So sometimes there will be a communication device that will kind of sync up with or connect to your hearing aid. Those can potentially be covered if there's a medical necessity related to it. Hearing aid related audiology and post-evaluation services, right? So, every, the interval can vary based on the child. But every so often you're going to need to go back to your otolaryngologist. You're going to need to go back to your audiologist for checkups, making sure that your next set of devices is appropriate for what you need at that point in time, or that everything is still fitting correctly, or you need ear molds in between. There are all sorts of reasons, but we want to make sure that you've got access to those in between services as well. So we try to be as inclusive as possible, and it tracks to what Medi-Cal offers for children the same age, so up to 21st birthday, as long as it's hearing aid related. We do want to kind of mention coverage determinations are based on medical necessity, right? So providers are kind of responsible for determining that. You're generally not going to have to worry about that as the parent. You can just check with your provider, but it's not limited based on how expensive something is. It's based on what the medical need of the child is, if it's a covered benefit. So while it's not unlimited upgrades just to do a fancier version, if it's not medically necessary, we do make sure that if it is medically necessary, we're going to make sure that that's available within these covered benefits that are available to Medi-Cal and HACCP children. So if you come across something that seems like it should be, definitely let us know. We're here to help, and we want to make sure that we're getting your kids what they need. Specific examples of some of the audiology and post-evaluation services or other kind of accessories that we mentioned include hearing aid assessments. So that just very initial step, the hearing aid itself, whether it's monaural or binaural, electroacoustic analysis, real ear measurements, minor hearing aid repairs. And we do have, for those who prefer a more technical list, the HACCP provider manual that's available at the link here, which is also available on the HACCP webpage under resources for medical providers. Want to make sure that that's easy to get to, that you know where it is if you are looking for those specifics. But if you have any questions, please definitely reach out to us and we can help you work through any of that as well and find what you're looking for. I mentioned the treatment authorization process for the documentation that we recommend you bring to your first appointment. So once you're enrolled and once you've seen your provider and gotten that hearing aid assessment, and this is the recommendation to move forward with a certain pair of hearing aids. It may apply to certain other benefits in certain circumstances, but it's primarily for your primary hearing device. And we'll talk about the nuances in a minute here. Your provider is going to then let us know, hey, my patient needs this model. They need one or two, depending on what's needed. And they might need, these batteries, ear molds, additional services to go along with it. And so they send that over to our team that does TAR authorization review so that we can say, oh yeah, that's all within what's covered. Confirm yes, that matches up with the program. Yes, that matches up with the medical necessity information you sent over to us. Because your provider actually needs to show us that, yes, there is a prescription so that these can be legally dispensed in California, and what the otolaryngologist recommendation was from their review and looking at your medical history, talking through everything with you. It's just another quality control step for you, but it's also part of how we make sure that the program can last a long time by being above board with how we spend taxpayer dollars. So this review process is really about protecting patients, protecting taxpayers, making sure that what we're approving as expenditures is also the right device for the child, because sometimes there'll be an instance where, okay, what was recommended was a good fit for that kid, but there's actually an even better option available now that the provider might not have known of yet because we hadn't published it very long ago yet, so they just hadn't had a chance to see it. And we want to make sure that they know in those situations, like, oh, hey, is that still what you want us to approve? Or, did you want to consider this and whether this might be an even better fit for your patient? Those types of additional supports. So bottom line is we want to help you get your child exactly what they need. And this is one of the tools that we use to do that. CHCS does generally respond to TARS within 30 days of receipt. Process-wise, TARS can come in either before or after the service or item is dispensed. But for the more expensive items like a hearing aid, you'll generally want, you'll see your provider more likely to wait until they get the authorization to do the order just to make sure there's no changes. But it can go either way. So if your provider is really confident about this being the right covered benefit for your child, that's certainly an option that you can talk to them about. Some benefits, like I mentioned, hearing aids always require an approved TAR in order for the provider to be reimbursed for that. There are certain other items that are covered benefits that don't need a TAR unless you use more than a certain amount within a certain time period. So ear molds are a good example. Most kids only need 1 or 2 at a time. Depending on how old your child is or how quickly their ears are growing, you might need more than 4 ear molds per year though. So if your provider is trying to bill for getting you more than 2 ear molds at a time or more than 4 within a year, they'll send us a TAR request before they can bill, but it might be before or after they get the ear molds to you. And it's just, oh, hey, here's the reason that this was, going through more frequently than might be average for the total population, but it makes sense for the child's young age or something like that. For TAR supporting documentation, this list should look really familiar because it's exactly what we requested you bring to your first visit. It's going to be 2 documents from your otolaryngologist or ENT, right? The prescription and the examination documents for the medical history and the physical exam. And then there are 2 pieces of information that we want from the audiologist who's dispensing the hearing aids as well, right? Or if you've seen a previous audiologist recently and you can provide this documentation to the dispensing audiologist, that works as well. So they're going to provide their documentation of the audiologic report and hearing aid evaluation and the specification of the ear or ears to be fitted. Again, those pieces are things that your provider is going to take the lead on. They might just ask you for the document, but they'll actually submit the TAR. You don't have to worry about doing that yourself. We do get, moving forward, and some of this will loop back as well. We do get some of the same questions fairly commonly. So I want to touch base on those just to kind of resolve any questions. We do also have a Q&A feature over where you might normally see a chat box. We have a Q&A option, so you can add your questions there. And I'll go ahead and respond through to those as soon as we close the slide deck. The first one that we get a lot is, my child definitely qualifies for CCS, or my child already has CCS coverage for hearing aids. Should we switch to HACCP? No. CCS provides a robust set of hearing aid related benefits. They have access to be able to provide your child with a lot of wraparound benefits as well, though, that exceed what HACCP or even Medi-Cal has access for. And so because of that specialty coverage that is so comprehensive, if your child has access to that, definitely keep that. Where we like to kind of be a puzzle piece next to CCS is if your child, doesn't meet the criteria to enroll in CCS, or if they don't meet the diagnostic criteria for hearing aid specific coverage in CCS, that's where HACCP can help. So if, for example, your child has CCS coverage, but it's for a different condition and they don't meet the criteria for hearing related coverage, then in those kind of unique situations, it would be possible to have both CCS for one set of specialty care and HACCP for your hearing related care. If your child, this is kind of the bottom line, if your child is enrolled in CCS for a hearing related condition, then that makes them not eligible for HACCP. If you're not sure whether your child is eligible for CCS, you can absolutely apply for both programs at the same time. Please feel free to do that. If you've got the documents out for one, you might as well submit it for both. They're asking a lot of the same questions. So we're happy to process that. And if you happen to be enrolled in CCS, by the time we get through the HACCP application, which is usually a pretty quick turnaround on our site, it's like within a couple days, we're happy to just let you know, like, hey, we see you in CCS, in our system, congratulations. We'll just go ahead and set this aside for you, but let us know if you need coverage later on. On the other hand, if your HACCP application gets processed first, it can provide some support while you're waiting for a CCS determination. For children who have partial insurance coverage, like through a private plan, what HACCP is now able to do as of just this year is provide supplemental coverage. So this is, I think, a big win for the program in expanding. Definitely a bigger win for families who may have hearing aid coverage through their plan, but it might be limited to $500, $1,000, $1,500 a year. For any of those that are kind of the low coverage limits, $1,500 or less per year, you can go ahead and apply for HACCP. And essentially, HACCP is just going to be your secondary coverage for hearing aid related expenses. So if you've got to be going through a Medi-Cal enrolled provider, right? Whether or not they're in the HACCP provider locator, they've got to be Medi-Cal enrolled. Then they can go ahead and bill to HACCP as secondary rather than essentially giving you an invoice after your insurance pays whatever portion they're able to pay. They would just send that to us instead. So your provider does bill your health insurance first, and then they bill us second. If you are trying to find your insurance plan's explanation of coverage, you should have received an explanation of coverage document when you first enrolled in your plan. Again, if you've just enrolled in a plan, it might take a little while to get to you, especially if it's for a new plan year. They might send all of those out usually at the end of the current calendar year. However, you can also call the health plan's member services to request they send you a copy. You can often also access it through their online webpage or member portal. So if you have any issues finding it, you can definitely call us and we can help you walk through where to locate that. We're happy to help however we can. It is a document that you have a right to. So different plans might provide it in different ways, but it should definitely be available so we can help you track it down. We'll often get asked, my child needs a bone conduction hearing device or BCHD, or like I said before, sometimes referred to as a BAHA. Are these covered? HACCP does cover surface-worn bone conduction hearing devices when they're medically necessary. What we're not able to do is cover surgically implanted BCHDs or cochlear implants because those fall outside of what ended up getting considered hearing aids for most purposes. So generally, you will find that those are not excluded from the private plan coverage since they're treated more as a surgical procedure or prosthetic that is granted more comprehensive coverage through the main private plans. BCHDs, just like other hearing aids, do require TAR approval before the provider can be reimbursed. So you'll often see your provider wanting to get that approval first. But you can work with your individual provider who's going to be dispensing those and fitting your child to make sure that you have the correct information for their clinic and their procedures, or if they can get anything ordered ahead of time. Folks will ask whether parents need to pay anything out of pocket for HACCP covered services. Generally speaking, no. So providers are going to bill HACCP directly for any covered benefits, just like they do for Medi-Cal and CCS. However, for those who use HACCP as secondary coverage, since that applies only after your primary coverage covers its part, if your primary health insurance includes copay, coinsurance, you may have to pay that part, but it would be on the front end with your primary insurance. It wouldn't be after the fact. So once your provider has billed HACCP, you shouldn't be seeing any more out-of-pocket costs because there's no balance billing allowed through this program, just like there's no balance billing allowed through Medi-Cal. There's no authorization required to see an HACCP participating audiologist. However, certain audiology services themselves may require a TAR in order for the provider to get reimbursed for seeing you. So different providers are going to have different policies. It might depend on what the service is. Some things are going to be really easy to get approval because it's medically necessary in most of these circumstances. Some things they might run into a question and just want to have that approval signed off on before they schedule the appointment. So the best solution on those kinds of questions is to check with the provider and see what their individual policies are. What happens if my child's application for HACCP enrollment is denied? So if your child does not qualify for HACCP, you'll receive a letter explaining which eligibility criteria weren't met and how to request reconsideration of your application if you feel there was a misunderstanding, or how to reapply if your circumstances change. We also let you know if there are other programs that may help. So in certain situations, like I mentioned, you might apply for HACCP and then find out that you're actually eligible for more comprehensive coverage through Medi-Cal. That's good news. So we'll be able to connect you with additional information about Medi-Cal and how to enroll and make sure that the county is available to support you and get you all hooked into that process. We do also, as I mentioned earlier, want to make sure you've got the contact information for HACCP Help Center. This information is also listed on our webpage, which is just dhcs.ca.gov/HACCP. We are available by phone, including translators and video relay or TTY, TTD. We are also available during those same call center hours for online chat, which is HIPAA compliant, protects your medical information. If you have a specific question you want to chat with them, that's a safe place to do that as well. The online chat is available in English or Spanish. It also allows you to upload documents securely 24/7. So, for example, if you send in your application on Monday and then you realize on Wednesday, oh no, I forgot this extra page, but I just found it on my desk. You can go ahead and call us and we'll let you know if we've already gotten the rest of the application, or you can chat with us. And if we do, then we can give you a family member number that you can just write on any other documents you want to submit so that we can match it all up, or we can pull it aside and watch for the extra page. And that way we can kind of help you connect those pieces. The secure upload is a great way to do that quickly instead of waiting for a second, mailed envelope if you happen to apply that way. You can also email us at haccp@maximus.com. While we make that available for general questions, we still tend to recommend phone or the online chat as kind of the most secure and most accessible ways for most folks to contact us. We do also, as I mentioned, have an HACCP webpage, which is dhcs.ca.gov/HACCP. You can learn more about the program there. You can find a provider. You can access the online chat. You can also apply online for coverage. So there are links from the main HACCP webpage to apply for coverage, but you can also go directly to haccp.dhcs.ca.gov and complete the application there. It'll ask you to create a secure login. So you want to make sure that you have, email access ready and available to create that login. If you have any questions as you go through the application portal or what does this question mean, please feel free to call us. We love to help. Definitely want to make sure that this is an easy process. We do also have an upcoming, if you're a medical provider or hearing professional, or if you happen to work with some, we do have an upcoming webinar for medical providers and hearing professionals as well. So that will be on December 19th at noon. And more information as well as the registration link are available at the HACCP webpage. Just want to kind of highlight that in case folks are interested, and then I'll have more of the technical information as well. And we'll have our wonderful clinical consultant, Dr. Kamuka, joining us as well for that one. So you can ask him all the questions that I don't know the answers to about the medical side of things, if that's your side of things as well. Thank you very much for joining us. I'm going to close down the screen share so that I can actually see the questions. If you have any questions, please pop them in the Q&A, and I'll be happy to chat through them with you. Make sure we get all of these answered. See here. So is the federal poverty level in Orange County still at 266% to be eligible for HACCP? Most of the parents we work with make more money, but their insurance still does not have hearing aid benefits. Let me double check, but I don't think Orange County is one of the HACCP counties. Okay, so the County Children's Health Initiative Program, or HACCP, higher income range is for San Mateo, San Francisco, and Santa Clara counties. So Orange County and most of California is still using that 266% threshold, which is essentially the ceiling on Medi-Cal eligibility. So if your household income exceeds the Medi-Cal eligible range, but it goes only as far as 600% FPL, so between Medi-Cal and 600%, that's where the sweet spot is for HACCP. So Jennifer, thank you. Yes, the Medi-Cal 266% federal poverty level is still applicable for Orange County. So you would want to be looking at between that Medi-Cal for kids range and the HACCP maximum. So for a family of four, again, that was $79,800 to $180,000 as the annual income for a household. Sarah, so if a person only gets partial coverage but is required to pay part of their, is required to pay their copay, which can be the remainder of the full amount, do they get reimbursed? Okay, so it's a really good question, and it actually has a couple of different questions in it that I'm going to kind of break apart. So if you have private insurance that includes partial coverage for hearing aids, you then enroll in HACCP. We don't really consider it to be partial HACCP coverage. It's more just the order of operations, right? So it's second to get billed. So when we say copay, we're talking about that initial amount that's going to be listed on your primary health insurance card, right? So it might say $15, $50, $150, depending on what your plan is, right? That copay is generally a specified amount, or coinsurance might be a specified percentage. Whatever you would ordinarily pay before your insurance comes in. So if you go into the appointment and your provider says, okay, that's going to be a $20 copay today, and they charge you before you walk in, that's kind of what we're talking about. You still have to pay that $20 before you walk in, same as you normally would. Or whatever the copay coinsurance is. Depending on how your insurance lets you know they didn't cover the whole thing, that may feel very similar to the experience of having a bill for a coinsurance amount that's a certain percentage calculated afterwards. However, if you've already paid your specific copay or coinsurance that's required for your insurance to pay their part, that kind of closes the book for our purposes on that part of the process, and your provider just proceeds with billing HACCP the remaining amount. Part of that also just gets cleaned up in the process, in that your provider is going to send us a copy of what your primary insurance covered and didn't cover. So we already have a picture of when we're paying the claim, like checking the math on, okay, how much are we supposed to pay versus what was already paid, or what was that, $20, $40 copay that you paid when you checked in, right? So it's generally going to come in where you hit that annual limit on hearing aid related coverage. So if your plan covers $500, but you had a $50 copay, it's essentially you pay $50, then your plan pays the $500. But if your hearing aids cost $1,500, there's still going to be a bill for potentially up to $950 that gets sent to us. It gets sent to us instead of you having that follow-up bill, right? So it can sound complicated for something that we try to do to make things easier. If there's a certain situation where somebody's in the situation of having dual coverage and they have questions about how it's going to work in their specific instance, they can call us. We're happy to walk through the specifics of their plan. It's a little tricky when I'm trying to give hypotheticals or examples. I don't want to confuse anybody more. But definitely we can help you with the concrete example or the instance of what your coverage is. If you want to call us when you've got a particular appointment coming up, and we can walk through how much you expect it to be, how much Medi-Cal and HACCP can cover for that service, and what that might mean with your insurance. Might be a little bit more helpful in those specifics. I see another question. Thank you. My child currently uses a hearing aid in one ear. She may need one for the other. Will I need to reapply for her to have the other one approved? Very good question. So no, you won't. As long as your current HACCP coverage is still current. So when you enroll in HACCP, your coverage is good for up to 12 months. If you let us know before the 12 months are up that something has changed, say you moved out of California. Okay, thanks for letting us know. And this isn't going to cover services out of state or for non-residents, because that's part of our eligibility criteria. However, within your eligibility period, you're going to go ahead and, depending on which services your child needs, the provider who's offering those services to you may have to get multiple authorizations throughout the year from us. But that's part of the billing process, right? It's on the provider side. So let's say in this instance, your child currently only has a hearing aid prescription for one hearing aid, or their initial otolaryngologist appointment. The exam at that stage indicated that a hearing aid would be appropriate for one ear. There might be some other approach taken for the other, or hearing loss wasn't as much of a concern at that time. But however the case may have played out, there may be a supplemental hearing aid prescription required. Okay, we recommended one before, but we're recommending a second one now for the other ear. So they might want to clarify that. And certainly you'll be seeing the audiologist to make sure that all of the testing is appropriate for the correct hearing aid to be approved and dispensed for the second ear. But you don't have to re-enroll. So as long as you're within that eligibility period of 12 months, it's just part of the billing and treatment authorization process for your provider. So they may ask you for documents, but you're already in the program. The one other thing that I want to kind of clarify, since we're here on the topic of once you're enrolled, it's good for 12 months, is that as you get towards the end of that 12 months, you're going to get a letter from us saying, hey, your coverage is almost up. We're assuming you might still need it, or you might need it back in a couple of years when your child's due for their next hearing aid. Go ahead and fill out this form so we can keep you enrolled and just make it easy to stay continuous covered. Or, let us know if you plan to, re-enroll in a couple of years, when your child might need it next. For example, in situations where you've got partial coverage that's enough to cover ear molds and batteries, just not the main hearing device. So those are some options. We try to make it really easy for you to just roll into the next 12 month kind of renewal period, make sure that your child continues to have the coverage for hearing aids. So I got another question. Has the provider list changed? Before, it seemed like there was only a handful in the area who were participants, but any audiologist who takes Medi-Cal can now participate. Okay, so I'm going to answer that part before I go into the next question. So from the very beginning of time in this program, any Medi-Cal enrolled provider who takes fee-for-service Medi-Cal and can bill fee-for-service claims has also been able to bill HACCP claims, right? We don't have a separate eligibility process for providers. If you're Medi-Cal enrolled, you can bill Medi-Cal. You're good with us too. It's the same billing system, assuming it's a relevant scope of practice. So if you're a podiatrist or other specialty provider that has nothing to do with hearing aids, it wouldn't be relevant. But if it's an audiologist who's fee-for-service enrolled, as your example is, yes, they could participate since the beginning of the program. The list itself is an opt-in process. So most of the providers you'll see there are willing to take new patients. And they're specifically engaging with HACCP. There may be some providers who are Medi-Cal enrolled that don't take it because they're so busy with with their existing Medi-Cal patients or with their existing private plan patients. But they're still eligible to. So if you go to the fee-for-service Medi-Cal provider list, you're certainly welcome to call those providers as well. And we actually link to those lists from the HACCP provider locator. It can certainly help you find a more conveniently located provider. It doesn't give you as much information about what that provider offers, and it's not as close of an indication that that provider is kind of actively taking new HACCP patients. But yes, they can participate. They're perfectly eligible. We encourage them to participate. There's no secondary enrollment process required for HACCP as far as providers go. I see your second question was, if ear molds don't require a TAR, then is that a quicker approval? If they don't require a TAR, then that's no approval. There's no need for a pre-approval before the provider submits their claim. They will have to dispense the ear mold before they can bill us for having dispensed an ear mold. So generally speaking, if a covered benefit requires an approved TAR, the provider can submit that TAR for approval before or after they provide the service. A lot of providers tend to do that before, because if they've already provided the service and then something happens where that's not the final version of the TAR that gets approved, they don't know that ahead of time to change what they're going to provide, right? So they end up providing the first thing essentially free unless they can get it back, which they can't get time back, or providing a second item but not being able to get reimbursed. So it can slow things down if you try to take the shortcut, depending on what it is. But some things like ear molds, it's more of a paperwork process than it is necessarily a risk to the provider. So things like that, you're more likely to not have it delay treatment anyway. Those are generally a pretty quick authorization. And in the provider webinar that's coming up in December, we'll actually go through some tips and tricks for providers in how to, put those types of TAR requests in with their TAR for the main hearing device, so they can kind of bundle those things and not have to go through the process more than once and save the provider and the family some time. So that's the kind of technical content you can look forward to there. But if it's an ear mold that doesn't require a TAR because you're only getting 1 or 2 at a time and it's a total of less than 4 within a year, it's not just a quicker approval, there's no pre-approval required. And yes, the child would be able to get their ear removed before the audiologist bills, depending on the audiologist policies. Batteries, sorry, this is, it looks like the last part of your question, do not generally require a TAR. If you need more than a certain quantity, it may, but I've yet to see a situation where that comes up. We cover a pretty high number of batteries without requiring a TAR. If you think you might be close, or if you have questions on that, you can certainly, I don't have the number right in front of me, but I'd be happy to answer that question, or make sure that our call center has that information available, so that they can help you out with that question if it comes up. But generally speaking, they would not. Got a question, can I reapply or renew online this year? So yes, you can submit. It's just through the same online application portal. And we're working on doing a streamlined version of that for renewals or reapplications, but it's not live yet. Those take a little bit of time to process and implement. So something to look forward to, depending on when you're due for renewal. In the meanwhile, you just submit, it's the same online application, and we're working on making sure that stores your prior information to make it even easier. You could just check through things and make sure that nothing's changed. You don't need to submit a referral or prescription again. What we would need to see is your updated insurance information and your updated income information for the household, just to make sure that those still qualify. And you're going to make sure that we have your current contact information and all of that, or let us know if it's changed. But yes, you can do that online just as well as you can do it on paper. See if families are having challenges with the application process, is there someone they can contact to answer questions? Yes, there is. Please contact our Coverage for Children Program Help Center. I'm going to paste that contact information in the chat as well. Because we definitely want you to reach out to us if you're having issues. We want to make this as easy as possible. So I'm answering that in writing in the Q&A as well. So you've got that contact information there, as well as in the slides that will be on the webpage. Is also available if you scroll to the bottom of our HACCP webpage. We've got all the contact information there as well. Call center hours, all of the good stuff. I've got a question regarding a family stating that everything like ear molds or batteries require an authorization, takes 30 days for approval. That's not the case. However, if there's, at least it's not a requirement from us. Generally speaking, if we get a TAR request for ear molds or batteries that is not because they anticipate going over the maximum, we'll just send it back with a message saying, nope, you actually don't need a TAR for this. Like, go ahead and bill directly, and just let them move forward. If there's a provider who maybe is submitting it just in case, I can see that maybe taking a day or two for them to submit it and us to kind of get it and send them that note, but it shouldn't be 30 days. In fact, we work on kind of the assumption of turning around all of our TARs for feedback within 30 days. But this is a small program, and we offer special handling options that providers can include with their TAR to get it straight to our team that's already familiar. So we tend to turn these around a lot faster than that, unless there's something like a document missing or a question that doesn't make sense, that maybe we have an ongoing conversation with the provider to make sure that we're supporting them the best we can. Generally speaking, you're going to get feedback way sooner than the 30 days. That's just the official within timeframe that we offer. So I'm not sure what happened in that instance. If you want to contact us offline and we can kind of maybe work with you on some specifics, or get some specifics so we can chase it down and make sure that the family has the support they need if you're not their provider, we can go ahead and certainly offer that support as well. So Sorry, next question is whether the ear mold limit is 4 ear molds total or 4 pairs of ear molds per year. So if 4 pairs would be 8. This is an instance, the TAR requirement comes in if you're ordering more than 4 ear molds total, like 4 individual ear molds per year, which, as you point out, for infants and toddlers, yes, means most of those very young patients, it's going to make the most sense for the provider to go ahead and include a TAR. And this preview of the provider webinar, you can have multiple line items within an ETAR, which is what we recommend doing. So if you're submitting a TAR as the provider for the binaural hearing aids, and this is a 1-year-old who's going to need more ear molds within that 12-month period that you can write a TAR for, than just the 4, just go ahead and put in, okay, requesting 10 ear molds or 6 or whatever it is that the dispensing provider believes is most likely to be the medically necessary number. And then as you bill, like once you've dispensed each pair or each individual, if it's a monaural hearing aid, our systems keep track of that, right? So your authorization, you can think of like an inventory of, I've already got pre-authorization for up to this many. And as you go through and claim those once they've been dispensed, it'll track off how many have already been paid. And when you get to the end of them, then you'll get a notice saying, oh, you need a new TAR before you can submit these to be reimbursed. But it's pretty self-sufficient automation there. So we're real people on the TAR end who can help you or provide feedback if there's a question on what the TAR looks like or which document might be needed for something like that. So we definitely try to make it as easy as possible. But yes, 4 ear molds total within that 12-month period. And as far as BAHA coverage, yes, thank you. These are really good questions. Thank you very much. Does HACCP cover BAHAs? Yes. So anywhere in the presentation that you see references to surface-worn BCHDs, same thing as surface-worn BAHAs. So it's going to be any of the bone conduction hearing devices that are on the soft band or adhere with a sticker, but not the ones that are surgically implanted. Those would be, the surgically implanted ones would be outside the scope of HACCP. The surface-worn ones we do cover as essentially an advanced hearing aid. Check over here, make sure if I've got any other questions that might be visible. Looks like we got them all. If anybody has any additional questions they want to check in. Oh, you guys are good. Are the soft bands covered? Yes. We do cover surface-worn BCHDs as well as their batteries and accessories, just like other hearing aids. We would cover the medically necessary accessories and the batteries. Can families just access HACCP for the ear molds and batteries if they already have hearing aids from a sibling? Oh, good question. So we would definitely still encourage you to, see an otolaryngologist, see an audiologist, and make sure that those are the medically appropriate hearing aids to fully meet that second child's needs. But yes, you can get just ear molds, just batteries. You can even get just audiology services if those are excluded. Any of those covered benefits you can get once you're enrolled. Some of them might require treatment authorization. For example, certain specialty audiology testing might require treatment authorization. But yes, you don't have to get your hearing aids through us to get other covered benefits covered through us. What you might have come up if you need more ear molds than the 4 per year. If there's a TAR required, you might get some questions, or your provider will get some questions if they don't already include it with their TAR. Just clarifying, like, yes, this child does have hearing aids already from a different source. They just need the ear molds to go with them. And maybe a question to make sure it's the right ear mold code we're improving depending on the certain hearing aid that they already have. But that should be pretty straightforward to get approved. And in most cases, especially if it's an older child, you wouldn't end up needing enough ear molds in a year necessarily to need a TAR anyway. So it should be pretty straightforward for the provider. Okay, so clarification too that I'm seeing. Okay, oh, this is in the visible part. So thank you, Dr. Kamuka, for chiming in. Just want to highlight, depending on the manufacturer, you might see the term Baha used just for the surgically implanted bone conduction devices. So just want to clarify, the only ones that we cover are the surface worn bone conduction hearing devices. I believe there might be one manufacturer that maybe uses the terminology otherwise. But as Dr. Kamuka points out, yes, not a good idea to share hearing aids just because we've got different needs. I don't want to speak for our audiology experts on the extent of programming available if the kids have very similar specific needs. If programming might be able to assist with that, I don't have that expertise, but definitely defer to Dr. Kamuka. It's not what we want to be our go-to. Let's see if we have any other additional questions. Okay. These are lots of new ones today. Thanks for keeping us on our toes. We really appreciate you all joining us. I know we're over a little bit of time. Thank you very much. And thank you also for sharing your morning with us. Definitely let us know. You can reach us at the call center or the chat online if you've got any other questions. We look forward to seeing you again at future webinars with any updates we might be able to provide at that point in time. And thank you very much also to our captioner and ASL. Very glad to have you both with us and helping folks engage. So I hope you all have a great rest of the afternoon. See you next time.